Hi, I'm Dr. Margriet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust.
This episode is brought to you by Simplex, who has been one of the market leaders for more than 2 decades, providing quality products at an affordable price, trusted by moms and midwives alike. Visit simplex.co.za for a healthier way of life.
Hi everyone, welcome back to another episode, and I'm so glad you're tuning in and listening or watching. And for today, it's a special one for me because it's the last one of the year. We've yet come to another end of the year. It's December, and that's a time for us to reflect. So first and foremost, I want to thank you all for being such amazing listeners and watchers, for our audience, for engaging with what we do, for the guests that has been showing up to bring this amazing content to you, and for our listeners. That's why we are putting it out there. So I hope you have been enjoying this journey with me. And also it's been 5 years of podcasting for me. Can't believe it. So time flies when you're having fun, right? But it was in 2020 that I started with podcasts, when I took over from Sister Lillian herself. And for today, I wanted to just reflect a little bit on this year, and I will be the speaker for today. Because I thought it might be a good time to just share a little bit more about myself for the ones that don't know me. And I also want to specifically share about my academic work that I've been doing, which completely ties in with everything we do with Sensitive Midwifery and Sister Lillian Center. And you can see in front of me, or if you're listening, you can imagine I've printed out an article that have been published recently, and that is an article from my PhD work. And for anyone that is working in academics, you just know what an achievement it is, how much work has gone into getting an article published and get your work out there. But then I also realized that not many people will actually read your article as much as you hope they will. And academics will, and they will refer to it in their own work, and that's how you add to the body of knowledge. But for the practicing midwife or doula, or for the moms out there, my work is very, very relevant. So I would love to talk a little bit about it and what the article is all about. So the title of this podcast, therefore, is Woman-Centered Care, not a nice to have, but a have to have. And that is the slogan that I came up from all my work that I've been doing basically in my life. We are all on a journey. It doesn't all just happen in one go. I never thought that I will end up having a PhD and where I will develop strategies in and around woman-centered care. My work started as a practicing midwife in the Eastern Cape. Actually, before that, in the Netherlands, my first work experience was in the Netherlands. I studied to be a midwife in Belgium. I'm a direct entry midwife, which means I studied just midwifery. Well, not just midwifery, that is everything about midwifery. So I was a well-rounded midwife, had a full bachelor's degree in midwifery when I came back to South Africa, the country of my birth, that I love so very much. And I was very pleasantly surprised of the state of midwifery in South Africa, and realized that it's not the same in every country. In fact, it can be very different. So I started on grassroots levels, working in the Eastern Cape and Jeffreys Bay, where we started a mom and baby clinic, an NPO that's still up and running, doing amazing work, as well as a private midwife where I was working, doing births as an independent midwife. And that's where I learned so much of everything that I'm doing and teaching now on these platforms, Sensitive Midwifery and Sister Lillian Center. And that also drove me to go study more and to contribute to midwifery in South Africa, because there's so much more to it than many of us experience. So one of the main things that I encountered working in South Africa as a green midwife, working in the government sector, is that we've only tackled one aspect of care, and that is making sure that the medical checks are done and that medically everything is written down and that the baby makes it out alive. But there was very, very little attention for individualized care, for the holistic well-being of the woman and the baby and the family unit. The sensitivity in care was often lacking. Then there was an over-medicalized approach to births, meaning that birth was more seen as a sickness and not as a natural life event. You labeled as a patient when you're going to give birth. Oftentimes there's doctors involved, so a midwifery is a bit on the background. Now that really was interesting to me because I've known it quite different where I worked before in Europe. And now you can think, well, that is a luxury to have, that we look at women in a holistic view and that we have things like women-centered care. But I want to prove you wrong, because it's not a luxury, it's a have to have. Because if we understand what women-centered care really is, we will want to really invest in that, because it will improve our outcomes. We will save so many lives of moms and babies, and we will have healthier generations. Our family lives will be healthy. It is so key, so important. And for South Africa and many countries, we need to do a lot of work to achieve really beautiful women-centered care. Well, through all the interviews that I've done and the research I've done, there are many aspects when it comes to women-centered care. So I traveled extensively through the country and interviewed midwives and women in hospitals and get their experiences about the care they're giving and the care they're receiving. And from that, we developed the strategies that I want to discuss with you today. But if you want to read up more on the actual interviews and what the women's voices and the midwives' voices, there was another article published on that. Very interesting, and it's so important that we let women and midwives' voices be heard. But when it comes to women-centered care, what is that actually? There are a lot of definitions about it. I stumbled across the concept in my academic journey, and it actually really put a nice word and a concept to something that for me is totally part of midwifery and should be part of midwifery, and that is that obviously the woman is at the center of the care. It's about her and about her baby. In medicine, there's also things like patient-centeredness or family-centeredness, but I think for birth, it's very important to, I like woman-centered, because it's the woman that's going to give birth to her child, and for that whole process, it's about her and her baby. But women-centered have lots of aspects to it. It's often a partnership, so it's a partnership between the woman and her caregivers, an equal partnership. So there's an interaction happening, there's shared responsibilities, shared decision making. It's not here from the doctor or the midwife telling a woman what to do. It's an interaction. So it's built on trust, it's built on relationship, it's built on empowerment on both sides, and it works both ways. And it's not only about taking the blood pressure and doing the blood test, it's a holistic view to it, as a woman being an individual person with a life, with own way of thinking, knowing her body, knowing what's going on in her body, and having that individualistic approach to her care. Well, if you've been journeying with me on sensitive midwifery and doing our courses there, you know that we are all about individualistic care and that we are not a one-size-fits-all. So women-centered care, again, fits in very beautiful with the work we do. So it would be a no-brainer to have women-centered care, right? Unfortunately, the truth is that in the world out there, there are many other aspects that's come into the birthing world. I would say one of the main things is fear. So fear has come in, fear of litigation, fear of what if something goes wrong, fear on the doctor side as well as fear on the receiver side. When you think of something like women-centered care and midwifery care, you would think love should be the center. And we're trying to return to that, to love. I'm busy reading a book, The Roar Behind the Silence, from Sheena Brown and Sue Doe. And they actually unpack these two dynamics of love and fear, very, very beautiful. And there's many initiatives done. We've heard a lot about compassionate care and respectful maternity care. Those are concepts that are more and more into our space that we need to address. But I think it's come because fear has crept in. And in a caring environment, we're now guided by so many guidelines, so many protocols, technology. All of those things has contributed to try to support us to survive in this fearful environment. So women-centered care is often the last on the list to think of. But you can imagine that this is just a vicious cycle that's going to go nowhere, because if we all fear-led and protocol-led and guidelines-led and technology-led, the woman is going to keep being on the worst end, also being fearful, wanting to maybe sue more when things go wrong. And physiologically, she would not, her blood pressures will go up. She will not have natural births because her hormones are disturbed. So it is just, the system is just not working to achieve the end goal, and that's a healthy mom and baby. So something's got to change. And the strategies that we've developed, that I've developed with my research, and thanks for my promoters that has guided me on this road, Prof. James and Prof. Anne, absolutely heroes. We came to the conclusion that women-centered is the ideal. We understand that that's needed for everyone. It's not a nice to have, it's a have to have. But in order to achieve that, there are many factors. And the first one that we identified is that we need to empower midwives on how to provide women-centered care, and supervision and mentorship and empowerment is part of that. Good support and skills. So that element is what I feel is predominantly the work I do with sensitive midwifery at the moment. It's very much teaching holistic midwifery care, women-centered care, compassionate care, but also pure physiology, that we can go back to nature, to the basics, because that's all ties into each other. Then the other side is that we need to empower women, because remember, women-centered care is a shared responsibility, and you need to have an empowered woman in order to make decisions over her life. However, oftentimes with the authoritative place that medicine has taken, women feel inferior and they just do whatever they've been told, and it's not an empowered state. So especially when it comes to childbirth and it's her body, it's a life event, we need to empower women again to understand how their bodies work, to understand how birth works, how birth hormones work, how to be a mother, how to breastfeed. And that empowerment used to be more, back in the day, part of society. Women handed that knowledge over from generation to generation, but that is not happening in most societies. So education is important, and empowerment, and that can happen through communication, obviously, with your antenatal care. That's why antenatal care is crucial, is to have that place where you can interact with your healthcare professional, ask questions, make sure you understand what is happening and you understand what they are advising you to do. Then something else that has really happened a lot and increased so much over the years is antenatal classes, some form of childbirth education. Now that is obviously where you have more time that you can dedicate on understanding concepts and physiology and addressing all your questions, which is not always possible in antenatal care where there's restricted time. So antenatal classes is key, and then part of women empowerment is the whole building of a trust relationship. You can imagine that you will not share things that are really not going well in your life, or if you have relational issues, or if you have a concern with someone that you don't trust. So trust is so important when it comes to providing this kind of care. So for midwives and birth workers, doctors, doulas, maternity nurses, in every interaction that we have with women, we need to work on that, building that trust relationship, that I feel safe, that I can trust you, that I can share with you. And there are obviously different models of care that works well with that. So a continuous model of care where you can see one midwife all the time during your pregnancy, that is ideal, that you can, and that she would also do your birth. That is obviously quite elite kind of care, which you can get with independent midwives, where you have that journey with them for a long period of time. And that is where trust can really be built. But it can also happen in group practices where you see maybe a few professionals, but you know that one of them will also be of your birth, and that continuation is very important. And then another aspect is applied health education, because this is important for healthcare professionals that are listening. Sometimes we just want to give them a woman a whole riddle of do's and don'ts and, you know, your general advice. But you don't know what that woman already knows, and so she might not really find your advice valuable because it's like, yeah, I know that. Or you talk over her head and she's like, I have no idea what you're talking about, and it's not landing. So applied health education ties in with getting to know the person you're dealing with through communication, through building a trust relationship, and then your education will be way more effective by making it individualized. So those are the two aspects. Empowering women is what we very much do at Sister Lillian Center. So you will be able to dive into all our resources. We have an academy, an online academy, with all sorts of beautiful courses to empower you for your parenting journey. And we have Find a Professional, when we can guide you to find a care provider that might be suitable for your journey. We also do online consultations. So if you want to have a bit more guidance in who to choose as your care professional, or finding out your birthing plan, or if you just have any medical issues, you can book a consultation. Most of the time you'll get me, if you can book me, and you can get applied education and information. So that is Sister Lillian Center. And then for the bigger picture, there's lots of things that are out of our control, and they are a little bit in our control, and that is more on leadership levels. So that's a bit beyond our scope of sensitive with Sister Lillian Center. However, I have a voice in these levels as well as a professional. We need to have an enabling practicing environment. So in order to provide beautiful births, you can imagine a need to be in an environment where it can be provided. And in South Africa, especially in the government sectors, oftentimes women give birth next to each other. It's nothing private. It's very clinical. It's noisy. It's not conducive for a beautiful birth, for a birth where hormones can do their work optimally, where women feel safe and secure. There's often things like staff shortages which need to be addressed. We need more midwives. We need quality midwives. So those are issues that are more systemic, that we need to lobby for, and that we need to make our voices heard. I think everything in the woman and child industry, we're often too nice and too soft. I've been told that also by other professionals. We're not by nature activistic, but we do need to, because we need to speak up for this, because our future depends on it. Healthy families depends on this. So we need to voice that we need better environments to give birth, conducive environments, the right policies, that women-centered care is the norm, which I'm excited about. And in South Africa, our new guidelines that are about to be published are very much in a very good direction to provide more women-centered care. So we're getting there, and we need to work on the workforce, on quality midwives. So that is the enabling practice environment. And then the fourth strategy is to have an enabling professional environment. And professional means that midwifery needs to be a profession, ideally an autonomous profession, which it is in many countries, and that is what the World Health Organization and all our global partners are driving, International Confederation of Midwives. Evidence is clear. If you invest in your midwives, you will see improvements in everything that I've been talking about. So in South Africa, we have a nurse-midwife confusion. It's all grouped in one for various valid reasons, but we need to work for the future towards a better professional environment, that we can train quality midwives that are very specialized and know exactly what it is when it comes to everything in maternal and reproductive health, which is not happening at this stage. So part of the recommendations is that we need to level up to the international standards of education. It's all out there, it's not rocket science. There are guidelines by the international bodies, and we just need to align with it and grow our professional body. Ideally, we have our own regulatory body, or at least a nursing and midwifery council. Currently, we only have a nursing council. So all those things are systemic issues that we need to work towards, and we're working on it as midwife leaders in the country. We need better recognition, remuneration, because all of this will filter through in the women-centered care and the care that you will receive as pregnant woman. So that is a little bit in my own terms. You can read on the articles, but the work we've been doing, that I've been working on, and that I'm actively doing on a day-to-day basis, is to make this happen. That we have women-centered care by empowering midwives and empowering women all the time. So that is what I wanted to share with you for today and for the last podcast of the year. For next year, we will, in 2025, have some very exciting new projects. Keep following us on all the initiatives that we do to drive this agenda. I'm excited for the symposium that's coming up for the midwives and the doulas and the birth workers, doctors, whoever is interested, and also looking into the work we do. The theme is going to be beyond basics. We need to move beyond the basics of just what we know is healthcare or is midwifery, and women-centered care I would say is, hey, let's move beyond basics. We need to address this, and there's so many things as midwives we can upscale ourselves. So that will be the theme. I'm very excited about that. For Sister Lillian Center, we continue to grow our education and keep a lookout on all that we have planned for you. We've got exciting partnerships with nice brands to make most of the education available for you for free. So I hope you enjoy that. Thank you again for being amazing followers and for journeying with us. Thank you for all our sensitive midwives out there that makes sensitive midwifery what it is. Keep up the good work, and all the best for all the pregnant mummies that are waiting for their babies during the holiday time. Not easy to be pregnant when everyone is on holiday, but yeah, trust you have a beautiful birth, and looking forward for engaging with you in the new year. That was me. Thank you. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.